Hello, our group Rachel, Chelsea, Pranavi, Kiana, me, Jada, Shelby, Shania, and Shreya are all group 6, and we are presenting on race, ethnicity, and disparities in healthcare. Today our topics are going to be genetics and their impact on health disparities, susceptibility to diseases based on race, and factors that contribute to implicit bias.
All right, so for this first part of our presentation, we wanted to talk about genetics and specifically genetic diseases and how that relates to health disparities and then also health disparities on its own. All right, so for this slide, we included genetic diseases that are prevalent in certain communities, and we decided to include the African-American community, the Asian community, the European community, and the Hispanic community. And we can see how, although they have similar genetic diseases that they're affected by, some communities are affected or have a larger or like longer list of these diseases that are affected, that they are affected by. And this relates to the topic about health disparities that Dr. Pryor was talking about, because if more communities are more susceptible to these diseases, that means they're more likely to have these diseases, and if they contract this, then they can be affected. Their whole life is affected, not only them but also their families. And we can see how, like, in the African-American community, they're affected by more genetic diseases. So the probability of them getting like a genetic disease increases, since there's a higher, longer list of the genetic diseases that they are affected by. All right, moving on to the next slide, we wanted to talk about health disparities in general. And I included this chart of the city of Chicago and how the concentration of African Americans relates to like unemployment, and how that is a disparity in its own. So, you know, lots of times we've talked about how it's easier in jobs to when, you know, you have a name that doesn't sound a certain way, you're able to obtain a job easier. And I think that's a perfect connection to this chart, because although unemployment can be for various reasons, you know, education and health, or not being chosen for the job, I think that it's a perfect example of a health disparity in a chart form. And I wanted to relate this to also this map of Chicago, and how we can see how in the previous map, the previous chart, here in the predominantly African American communities, the physicians are not located in those areas. And what does this mean for the African American community? That means they have to drive further to get help, to get medical help, and they have to drive further if they have to get medication. They have to drive further if they get injured and they all of a sudden need to go to the hospital, and that is a health disparity in and of itself. And then I wanted to relate this also to another health disparity that we see in low-income neighborhoods in Los Angeles, because I wanted to include major cities like Chicago, Los Angeles, and we can see how they have access to, you know, bars and food trucks and restaurants and liquor convenience stores and fast food restaurants, but their access to grocery stores is not a lot. And what does this mean for the health? This means that they're able to consume these like not poisonous foods, but in the long run, they do become poisonous if they keep on eating fast food restaurants, or if they keep on shopping at liquor/convenience stores. So this means that their health is going to deteriorate faster than someone who has access to these grocery stores, marketplaces, these healthier options. Now, to close off, I want to talk about how the history and like how you know, segregation and slavery and other historical events have affected, you know, how people have established themselves in neighborhoods. We've seen this time and time again, how people live in certain communities Like there's a Hispanic community in Chicago. There's a place where it's mostly made up of Hispanic individuals, and then there's another place that's mostly made up of African American individuals. And we've seen how history has caused these segregations, and these segregations have caused people to live in certain neighborhoods, and those neighborhoods have impacted their health. And if their health is in danger, then they're not able to sometimes get an education. And if you're not able to get an education, then you won't be able to get a job. And then it's just a big cycle of, poverty. And, we can see how health disparities and history has affected this. And yes. And now we're going to move on to section number 2.
For topic number 2 today, the first disease we'll be talking about today is high blood pressure. But first, what is blood pressure? How does it become high? Blood pressure is the force of your blood pumping against your arteries or blood vessels. On the picture in the right-hand corner, that gives you a little representation of what is occurring when the blood is pumping to the walls and the kind of pressure that is getting pushed against it. A normal blood pressure is 120/80. Now, with different elements of your life, your blood can begin to thicken, or you'll have narrow blood vessels, and the heart will have to pump harder, and this becomes high blood pressure. Some community factors that can affect your chances of getting high blood pressure is location, lifestyle, and social aspects. Those who live in the middle of nowhere or are not brought up in a nicer neighborhood are not going to have access to the healthy food markets, or to a local physician, or to a pharmacist to treat what they need to be treated to be healthy. Your lifestyle is going to affect you also, because how you live, how you brought up, what activities you're doing, how active you are is going to affect your chances of living a healthy lifestyle.
So, going more in depth towards the susceptibility of disease among different ethnic groups, CDC states that African Americans are the largest group to have a higher blood pressure, followed by 46% of white adults, 39% of Asian adults, and 36% of Hispanic adults.
Now, how are we going to prevent this high blood pressure? I know that many of these things can be hard for those who are living in the deprived neighborhoods, but they do have to make an effort to live a healthy lifestyle. The first thing that you can do is just to see your physician yearly. The yearly checkups can really make a difference.
Some health diseases are more common in some racial communities more than others. Here I've examined some of the causes of these health disparities. For example, living in air polluted areas near transportation corridors or factories that expel toxic waste can lead to health issues and illnesses. Another example would be a lack of health-related education, which can lead to diseases and illnesses. Another factor would be a lack of fresh fruits and vegetables in grocery stores, or the lack of accessibility to those grocery stores, which can lead to health issues and diseases. And another cause of these health disparities would be neighborhood environment. So according to doctors interviewed by WebMD.com, someone who may live in a higher crime rate neighborhood may be more afraid to exercise, which may also lead to health diseases and issues for them in the future. And unfortunately, most of these health disparities and these causes can be linked to racism and racially motivated tactics, such as historical redlining, which has impacted the Black community the most in America.
Now let's discuss language barriers and examine the effect of limited English proficiency in an English-dominant healthcare system. Let's talk about the statistics. In their expert opinion, 37% of physicians explain that they suspect that their patients hid information because of barriers. This can be very dangerous when it comes to medicine. Additionally, 94.3% of nurses shared that they felt that language was very important for communication with patients. Moving on to the patients themselves, 41.8% had difficulty understanding medication instructions. Now, this can be very, very dangerous. And as it was, 15.8% had a bad reaction due to their inability to understand medical guidance. 66.7% faced a barrier in accessing healthcare, and worst of all, 20% did not actively seek healthcare in fear that they would not understand their healthcare provider. Now, going forward, the best response would be to reduce the linguistic inequity. Healthcare organizations and clinicians can ensure that interpretive services are put in place and can make sure that translators are adequately staffed so that the patients can feel comfortable talking to their medical providers.
Hi, my name is Nurse Spina. How can I help you today?
気持ち悪くて腕も痛くてあと息がちょっと苦しいんです。
Sorry, I can't understand you. Do you speak English?
No.
You don't speak any English.
Stomach pain.
Okay, I'll see if I can find someone to interpret for you.
Yeah, I heard some commotion in here. Do you guys need any help?
She doesn't speak any English, and I think she speaks Japanese. Do you know anyone on the staff who speaks Japanese?
I don't, but we have the teleinterpreter we can call. Do you want me to go get it?
No, it's complicated to use and it takes too long. I'll just try and find someone who can interpret.
Okay.
Okay, Miss Horikoshi, I'm going to find someone who can interpret for you.
Hours later, a few minutes later, a little longer than a few minutes later, 2 hours later.
In room 15, Miss Horikoshi, she doesn't speak any English, so I haven't been able to assess her. I think she's having some kind of stomach pain, but I'm not sure.
Did you try the computer interpreter service?
No, it takes too long, and I'm not really sure how to use it. I asked around on the staff, but no one speaks Japanese. I was hoping someone on the night shift spoke Japanese.